All right. I have a question actually, whether it's myth. Your eardrums is really, really thin. Yeah? So they say it's onion skin almost. So it's how easy is it to puncture your eardrum? I mean, like you shout, in someone's ear, will that sort of cause the eardrum to puncture?
No. Normally, eardrums are perforated by either physical trauma, so if somebody is slapped on the ear,
okay.
and it causes the air pressure inside the ear to perforate the eardrum. But it's unusual to find that. It can be things like when people are diving, too much pressure here can cause this barotrauma and cause the eardrum to perforate. But the most common cause is infection.
So I was going to say, so you can also lose your hearing through an illness, yeah?
Yeah. It's very common amongst children. Children suffer from a condition known as glue ear that can cause fluid to accumulate in the ear and cause a loss of hearing, which has to be then treated surgically. So the eardrum is deliberately perforated, a small grommet inserted, drained out, and then the ear is left to heal.
If you've got a perforated eardrum, can you actually sort of like reverse cover the perforation? Can you actually reverse?
It is possible to do it.
It is possible?
Yeah, and it's something that ENT surgeons do very often, is repair damaged eardrums.
What about, sorry.
Yeah, I was going to say about hearing loss in general, there is no surgery per se, is there?
It depends on the type of hearing loss. There are two main types of hearing loss. One is a conductive hearing loss. That's the problem with a mechanical means of transmitting sound down the ear. And there is what's called a sensory neural hearing loss. Sensory neural hearing loss is the one that affects most people, and for this generally there is no surgical or medical treatment. There are one or two conditions that can be dealt with by medication or by surgical intervention, but generally speaking, if it's noise-induced hearing loss or age-related hearing loss, which by far make up the largest proportion of causes, then that cannot be dealt with by medical or surgical means.